March is Colorectal Cancer Awareness Month. The CDC ranks colorectal cancer is the second highest cancer killer in the United States, with 1 in 20 people being diagnosed with the disease in their lifetime. However, with early detection, colorectal cancer screenings can catch colon polyps before they become cancer, reducing the chances of cancerous diagnosis. Dr. Hunyh of Advanced Gastroenterology and Surgery Associates explains the importance of colon screening and what they are looking for.
Colon cancer screening is very important because if colon cancer detected early enough, it's very treatable and it can be preventable. If you do a colonoscopy and you see a polyps, the majority of the colon polyps that will grow into colon cancer, once you remove the polyps, that will prevent the patient from having colon cancer. The procedure is so simple and it's quick. It is beneficial to have the colonoscopy done for sure. We started the colonoscopy at 50 years old in the Caucasian population if they have no family history of colon cancer. If they do have colon cancer in their family history, then they need to do it at 40 or 10 years younger than the person in their family that have colon cancer. So let's say if a family member having colon cancer at 45, that person needs to have a colonoscopy at 35. Some of the new things we recommended for a patient to do a colonoscopy, like the Black population or diabetic patient, they should have the colonoscopy starting at 45 years old. Also with obesity, that's another new information for these patients. They should have the colonoscopy sooner, starting at 45. The day before the procedure, we give the patient some bowel preparation so they will have excessive amount of diarrhea to clean out the colon. That is the worst part of the whole process. Everything else is easy because the next day we bring the patient back to the endoscopy center. They will be sleeping the whole time. It takes about 15 to 30 minutes to have the procedure done. We have a long scope. It's about 6 feet long. It has a light and a camera at the end of it, so we look at a TV monitor to see where we are going. We will go into the colon and we will examine the colon thoroughly to make sure they have no colon cancer. If they have any polyps, we take them out right then. The procedure is simple and the risk is really small. It's less than 1% chance of complications. You can come in and go home in the same day. I always look at patients as my own family members because I do want them to feel that they have the best care provided to them. And for me, just being conscientious is the best way to go. You have to take care of a patient the best way you know how and just treat them as your own family member. And at the end of the day, we're here to help patients, so that's my goal.
For more information on Advanced Gastroenterology and Surgery Associates and their services, please click on the Colon Cancer Screening Story Link icon on our homepage, yourhometownhealth.com.